मुझे करो।
Narrating all of what I do basically. So then he just suggested कि उन्होंने एक चूर्ण का निर्माण किया हुआ है और उस चूर्ण का नाम उन्होंने रखा है वराह गौधूम चूर्ण, ठीक है? So he told me सारे ingredients उन्होंने बताए, around 47 ingredients उसमें थे and he said कि वराह गौधूम चूर्ण का हम उद्वर्तन करेंगे पहले और उसी वराह गौधूम चूर्ण का हम उसके बाद से स्वेदन करेंगे पेशेंट का, और इस तरीके की रिसर्च स्टडीज करके आइडिया पे हम लोगों ने स्टार्ट करी। सो वराह गौधूम चूर्ण जो है हमने यहीं पर ही प्रिपेयर किया अपने यहीं पर ही फार्मेसी में, और फॉर अ स्ट्रेच ऑफ 14 days वी डिड उद्वर्तन। सो मोस्ट 4th ईयर के यहाँ पे स्टूडेंट्स हैं यहाँ। उद्वर्तन का आई थिंक आप लोगों को काफी आइडिया होगा कि उद्वर्तन क्या होता है। Anyone from the first year, do you have any idea what basically is Udvartan? Anyone from 4th year would like to say something about Udvartan procedure? Yes, yes. Okay, so one from the first year student, what's your name, beta? Nidhi. So Dr. Nidhi, future Dr. Nidhi is saying that Udvartan is powder massage. So she is correct that Udvartan is dry powder massage. And what exactly it does is कफ मेद विमलापनम. And अगर हम डायबिटीज की बात करते हैं टाइप 2 डायबिटीज की, तो उसमें कफ और मेद का विमलापन अपने आप में बहुत जरूरी है। उद्वर्तन प्रोसीजर इसीलिए हमने इसको चूज किया क्योंकि हमें स्रोतोरोध को खत्म करना है डायबिटीज में, और टू बी वेरी मतलब इट वाज सच अ सरप्राइजिंग रिजल्ट टू सी दैट 14 डेज का हम लोगों ने उद्वर्तन किया वराह गौधूम आदि चूर्ण से, और उस उद्वर्तन के बाद हमने पेशेंट को उसी चूर्ण के बाद का हमने वाष्प दिया, सर्वांग वाष्प। एंड HbA1c लेवल जो था पेशेंट का was 8.9, it came back to 6.5. हमने ऐसे 8 पेशेंट्स का हमने ऐसा किया था पूरा, and very soon me and Dr. Satyadev sir, who is also my senior and associate professor also in the department of Panchakarma. So under this guidance and chairman sir's guidance, we conducted this study. और अभी तक हम, this is basically a pilot study. अभी तक हम लोगों ने 8 पेशेंट्स ऐसे किए हैं, और उन 8 पेशेंट्स का जो HbA1c लेवल है on the first day and on the 30th day, there is a marginal change in that HbA1c level. And very soon we hope कि हम वड़ा पौधुमादी चूर्ण को हम ईशान आयुर्वेदिक मेडिकल कॉलेज के नाम से ही पेटेंट करेंगे. So this is a very huge news for it. I think it should be a give right. You should all clap for this particular change. इस स्टडी में हम लोगों ने इंक्लूजन क्राइटेरिया में रखा था कि जो भी पेशेंट्स इसमें HbA1c लेवल जिनका 6.5 के बराबर या उससे ऊपर होगा, ओनली दोज पेशेंट वर टेकन इन दिस स्टडी. और बहुत क्रोनिक केस ना लेकर के हम लोगों ने जो अभी रिसेंट जो डायग्नोस्ड केस है, लाइक विद इन 1 और 2 इयर्स के अंदर, उस तरीके के केसेस हम लोगों ने इसमें लिए थे. और उसके बाद जब ये पूरा प्रोसीजर स्टार्ट हुआ, हमने फर्स्ट डे उनका HbA1c लेवल चेक किया था, फिर 14th डे पे उनका HbA1c लेवल चेक किया था, एंड देन आफ्टर 15 डेज ऑफ फॉलो अप, दैट इज ऑन 30th डे, HbA1c लेवल उनका चेक किया था. उसके अलावा फास्टिंग ब्लड शुगर, पोस्ट प्राइमरी ब्लड शुगर, और अग्नि बल, देह बल और चेतस बल, ये सभी हमारे क्राइटेरियाज थे. सो द प्राइमरी क्राइटेरियाज वर HbA1c लेवल, fasting blood sugar and post primary blood sugar. We got literally amazing results in all the 3 primary outcomes, and in the secondary criteria also we calculated Agni bal, Deh bal and Chetas bal. और पेशेंट के अंदर इन तीनों क्राइटेरियाज में भी बहुत अच्छा रिजल्ट आया. डॉक्टर स्वप्निल is about to join. Join. दो दस हो गया मैं स्टार्ट. Good afternoon all. So officially we are going to start our webinar series. I, Dr. Kavita, Assistant Professor, Department of Panchakarma, on the behalf of Ishan Ayurvedic Medical College and Research Center, welcome you all to this national webinar series which our college is conducting. So today's topic for the webinar is efficacy of Panchakarma in diabetes. To begin this fortunate day, I request respected Dr. Satyadev sir, Associate Professor, and Dr. Naved ma'am to kindly begin this fortunate day with lightning lamp ceremony. And for this, I invite first year students to kindly come upon the dais for the Dhanvantari Vandana. ये ऑन करता है. Stand up, close your eyes. Please stand up and turn your hands into your eyes. With this, I take this opportunity to welcome our first speaker, Dr. Avinash Chaudhary, who is Associate Professor, Department of Panchakarma, University, Haryana. Sir has been awarded for his work on dengue and chikungunya by Rajasthan Haryana Commission. Sir has been Sir has attended various national and international conferences, workshops, seminars, CMEs, training programs, camps. I would like to request Dr. Avinash Chaudhary to kindly begin his session. Over to you, sir.
Hello, am I visible? Hello, is my PPT visible? हेलो मैम मैं शेयर कर चुका हूँ मेरी पीपीटी विजिबल है क्या?
हाँ सर पीपीटी विजिबल है.
ओके ओके So very good afternoon to everyone. Myself, Dr. Avinash Chaudhary. I completed my MD Panchakarma from the KL Institute, and currently I'm designated as an associate professor in the Faculty of Indian Medical System. And the topic of today's discussion would be clinical practices of Panchakarma in diabetes mellitus. So, as far as diabetes mellitus is considered, we can understand that it is an umbrella of various type of disorders which are caused by endocrinal dysfunction inside the body. So what happens that due to an endocrinological imbalance, the body tends to get affected in various mannerisms and produce a clinical picture in which the patient which comes to the clinical OPDs would be complaining about polyphagia, polyuria, polydipsia, and other such symptoms. And there may be involvement of neurological cases also, or there may be involvement of the nephrological symptoms also. And such a combination of complicated symptoms would be presented inside the OPDs. And when we look on a broader sense, then we can clinically correlate that this diabetes mellitus tends to produce a picture towards the profile which has been told in the Samhitas, the profile of the prameha. So these would be the contents of the presentation. Coming towards, so I'll be, it is understood that diabetes mellitus, all the signs and symptoms are present over there, and it can be correlated to prameha. So I would like to introduce the disease. So the acharyas have told, Asya Sukham Swapna Sukham. So on at that time also, they were very clear that it is a lifestyle disorder. That means the type of, as it is known, that the way we breathe, the way we walk, the way we sit, the type of Jivan Shaili that we are going to subject to will lead to some kind of a, will be a nidan of what kind of a effect it produces on the body. So this is one of the most infamous lifestyle disorders of the current era. So why the current era? Because with the advances in the medical technology or the other technologies, what has happened that the ease of functionality has come, and with that ease, people have become more and more complacent. That has led to a kind of an satiety in the mindset of individuals, that okay, fine, we can sit, we can enjoy, we can have fun, and indulging in different kind of viruddha ahara, and that complicated system of living has led to many kind of lifestyle disorders. One such very infamous lifestyle disorder is prameha, or the diabetes mellitus. The acharyas were told that predominantly it is a santarpan janya vyadhi. So 99% of the time, whenever the patient approaches us, what will happen is that there would be a samprapti that would be visible inside the patient, and it would be of santarpanotha nidanas. No doubt that there are some cases also wherein when Vat is involved predominantly, the patient might have landed up into a Kshayaj Samprapti, which has also been told by the Acharyas that there is a section of patients who will show that there is Kshaya. That means there is some kind of loss of dhatus inside the body, and therefore it leads to that kind of prameha. But you can say that 90 to 95% of the time, whenever the patient comes to the OPD, it would be clearly visible by the picture of the patient that yes, the nidana or the type of lifestyle that he's following, that is completely santarpano. Now, the other thing that is very peculiar about this Prameha Vyadhi, that you can see that in Jwara, there is just involvement of Pitta dosha, or there is involvement of Ama, and there is involvement of Agni. Two or three elements together lead to a very big Mahagar, which is like Jwara. But here, the complication of the disease lines up because there are involvement of multiple dhatus, upadhatus, and mala. That means along with the doshas, there will be involvement of rasa, rakta, mamsa, meda, lasika, and mutra. And such a complicated mechanism tends to form inside the body, leading to the samprapti of the prameya. Another thing that is to be noted by the disease is that it is a disorder of the Mutravaha Srotas. And since the Mutravaha Srotas is governed by, as you all know, Apano Apanaga, Shonibasti Midraru Gocharaha. And the Moolasthana of Mutravaha Srotas would be Mutravahanam Srotasam Basti Moolam Vangshanam. So that area is completely the area of the Apana Valley. And hence the Samprapti forms somewhere by the Dushti of Sansarga of Kapha and Pitta along with the Apana Valley. Now, why this disease is very important to understand is because it is a chronic and life-threatening disorder, and the prognosis of the disease depends upon the doshas involved. So, why it is a life-threatening disorder? Because it has got a lot of upadravas. That means slowly and steadily it is a disorder wherein dhatus will flow out of the body, thereby at the end leading to aptarpana, or thereby leading to dhatu kshaya avastha, and the patient may land up into death also, or other complications causing death from this disorder can be observed. And the prognosis is dependent upon the dosha dushya samorchana, which is there in the disorder. As far as Vishesh Lakshan is considered, so like I said in the beginning, that diabetes mellitus, the patient will complain of polyphagia, polyuria. So you can see over here that Prabhuta Mutra Lakshanaha. So what is that? That is polyuria. Along with that, there is Netra Jiva Shravana Upadeho. So what is that? There would be Indriya Vibhransha. A similar picture is also observed in patients who are suffering from diabetes mellitus. Then there is dipsia is also present. That is, the patient feels a lot of thirst. So a similar condition like galatalu shosha. So whenever there would be galatalu shosha, the patient will always have a complaint that there is dryness of the mouth, dryness of the throat, and due to which I feel have a feeling of drinking again and again and again. Another such a symptom of neurological involvement, where there is told that there may be altered sensations in the hands and feet of the patient in diabetes mellitus. Similarly, Karapada Daha has been mentioned in our text. Okay. Now, to understand the picture, what we have to do is that we have to divide these patients as per the acharyas into sthula pramehi and krusha pramehi. So everyone, like I said, 90 to 95%, it would be sthula pramehi. The picture would land up that the patient is having or living a life which is santarpan predominant, whereas 5% to 10% you will find patients. We will see some case examples also I'll be discussing, in which the patient would be krusha. That means there would be significant dhatuksha in the patient. There would be loss of mausa, there would be loss of rasa, there would be loss of oja, and therefore the patient will clearly be debilitated, and you can see and identify that yes, dhatuksha avastha is present inside such a patient. Okay. And then further they have told that according to doshas they have divided into kafaja, pittaja, and vataja. The lakshanas are already present in the samhita, so I'm not going to go into detail of them. But you should understand that yeah, if it is kafaja prameha, so the vyadhi is kafaja, and medicines are available in a good amount of quantity. So these type of kafaja prameha are easy to treat. Pittaj become yapya, and vataj in a similar condition tends to become asadhya. So by asadhya, it does not mean that it cannot be managed or it cannot be controlled. By asadhya, it means that you will have to give some kind, one or the other kind of medication to the patient. Again and again, shuddhikaran, or again, Niyaman of Vath is to be done, or else it may land up into some one or the other complications. So, like I said before, that this disorder has got multiple upadrava like Trishna, Atisar, Jara, Daha, Dorbali, etc. etc. Moving on towards Nidana Vaishishtya, so you know that whenever there is Sansarga Anubandha of different type of Nidana, what will happen is that the amount of similarities between the Nidana and the Dosha will lead into easy formulation of the disease, and vice versa will lead to breakdown of the Vyadhi also. So Acharyas have told a lot of Nidan, you can go through the shlokas, but all in all, whenever there is like I can say the first point is about kafaja nidana, the second one is pittaja nidana, the third one is vataja nidana. So they have told that navan, navamadya, madhur rasa, or you are doing asya sukam, swapna sukam, you are not exercising, you are eating a lot of sweet foods, such kind of things have been told. So when you are trying to critically analyze the nidana, always remember that if it is ahara or vihara, it should be madhura guru shita, snigdha, stiramandan, abhishandi. These qualities, if are present in the nidana or the type of lifestyle that the patient is living, then there are chances that that patient might land up into kafaja prameha. Similarly, they have told ushna, amla, katu, tikshna, this kind of. So katu amla lavan ras pradhana ahara, kshara ati kshara sevan, ushna, tikshna, and snigdha. These are the qualities if are present inside the type of ahara or vihara. It could be kaik, it could be vachik, it could be mansik, any kind of nidan it can be, but it should have such kind of qualities, and then the patient may land up into pittaja prameha. So I think I have put it on full screen only. I hope it is visible. The last one that comes is the Vataj one. So the Vataj one, in what they have told that there is Kashaya Katu Tikta. So Kashaya Katu Tikta, as well as there should be Ruksha and Shita. These are the qualities that should be present. If these qualities are present inside the Nidana, then it will lead to Vataj type of, directly Vataj type of Prameha. Further, whenever you are a diagnosing practitioner, the most important thing is the Samprapti Ghatak and the Samprapti Vighatana. So what happens is that the acharyas have told a sutra. We will just try to analyze it, but they are told as nidana sevan. So kafaj, pittaj, and vataj. It could be a single type of involvement of doshas also, or it could be multiple type of nidana sevan, leading to multiple permutation and combination of doshas. And that doshas, what will do that these will come together. So what will happen here? Sanchay will start. Okay, slowly and slowly they will start gathering together, and therefore induce Sanchaya Avastha inside the patient. Next comes it slowly when the qualities become deranged, they will go into Vilayan Rupa Vritti, and that is Vilayan Rupa Vritti. That means it is now in Prakopita Avastha. And finally, they get start mixed with the Medhatu, and they start traveling all about the body. Okay, so now there is Sanchaya Prakop. Now what is happening over here? Here it is happening Sthana Sanshaya. Okay, so it is Sanchaya Prakop Prasara Sthana Sanshaya enters into the Mutra Srotas. Now it is going into the proper Srotas, where it is supposed to go into the Mutra Srotas, Sthana Sanshaya, and Vyakti and Bheda. That means the Vyadhi will be manifested, and different kind of Lakshana Utpattis will be present in the form of different type of discolorations or different type of properties which are present inside the urine of the patient. Okay, so that is how you should understand the samprapti. That whenever the patient comes to you, in what kind of avastha the patient is there. Okay, just a minute. To stop this. Hello, am I not audible? Am I audible? Anybody there? Hello.
ऑडिबल आवाज
So
आ
it
रही है सर आपकी?
आवाज आ
आ
रही
रही
है?
है? यस सर,
PPT
यस सर, कंटिन्यू सर,
ठीक
कंटिन्यू।
चल रहा है या नहीं चल रहा है?
सर पीपीटी नहीं आ रही है।
PPT is the PPT working?
नो सर, पीपीटी नहीं वर्किंग हो रहा है। आप अगेन शेयर कीजिए।
ना, मैं अभी दोबारा शेयर करता हूँ।
हाँ
एक
शेयर
मिनट,
कीजिए सर, मैं ऐड करता हूँ। उसकी स्लाइड नहीं चलाएंगे सर।
हाँ मैंने शेयर कर दिया, ठीक है।
यस सर, उसकी स्लाइड व्यू कीजिए सर। सर बॉटम में स्लाइड व्यू है, उसको स्लाइड व्यू कीजिए। बॉटम में
व्यू,
देखिए, हाँ स्लाइड व्यू कीजिए, पूरा फुल
जी
स्क्रीन में
स्लाइड,
आएगी।
हाँ स्लाइड शो करना है ना?
हाँ हाँ स्लाइड शो कीजिए।
हाँ हाँ, ये स्लाइड शो ये स्लाइड शो कर दिया मैंने।
तो
दिख
आगे
रहा है
कहाँ
आपको?
बढ़ रही सर? ठीक है,
हेलो,
कंटिन्यू कीजिए सर।
जी मैडम, जी मैंने स्लाइड शो ही कर रखा है। हो गया, आप देख रहे हैं? ओके, थैंक यू। As a clinician, what you have to do is you have to understand this dosha dusha samorchana, and you have to understand that in which avastha the patient is, whether he's in sanchaya avastha or he's in prakopa avastha or sansanchaya is going, or there is or the patient is into vyakti or bheda. Depending upon these, you will have to choose the type of medicine or choose the type of kriya that you are going to do. For example, the siddhant which has been told by Acharya Sushruta is that whenever the doshas are in vriddhi avastha, what you have to do is that you have to cause a kshay. Whenever doshas are in prakupit avastha, what you have to do? You have to do the nirharana of such doshas. So whenever there is prakopa, that is the ultimate time that you can go for shodhana kriya to the patient. You have to understand that the patient is into that kind of samprapti avastha, and therefore now this kind of treatment, either I'm giving oral treatment or I'm giving other kind of treatment, that depends upon all that. Okay? So as far as role of Panchakarma is concerned, so you can see that Mutravaha Sroto Vikara, in since it is a disorder of the Mutravaha Srotas, there is Acharyas have directly indicated Abhyanga, Snehana, Svedana, Niruha, Snehopana, there is Anuloman, Avgaha, Shishir Prabhe, all of these Panchakarma therapies have already been told. And when we look into the Prameha chapter, what they have told on a journal manner is that Shanshodhano. Okay, it is still stuck on the first slide, I guess. Is it moving okay? Okay, just a minute. स्लाइड ठीक चल रही है, नहीं चल रही है? कैन एनीबॉडी टॉक टू मी?
यस सर, स्लाइड ठीक चल रही सर, नो इशू।
अच्छा, नहीं मुझे वहां से मैसेज आ रहे हैं कि नहीं चल रही है। हेलो,
नहीं सर, अभी आ रहा है सर, ठीक। इसकी स्लाइड व्यू कीजिए सर एक बार ना, स्लाइड
हाँ
को।
मैंने हाँ हाँ कर दिया, मैंने स्लाइड
हेलो, सर स्लाइड शो एक
हेलो।
बार करके ना।
हाँ जी, स्लाइड हो गया, कर दिया मैंने स्लाइड शो। दिख रहा है अब?
हाँ सर दिख रहा है, लेकिन आपका ना सर वो फुल स्क्रीन में आ रहा है। नो इशू सर, आप कंटिन्यू कीजिए।
ठीक है। मैंने वैसे कर दिया स्लाइड शो। हो सकता है वो थोड़ा सा लैग हो नेटवर्क का, उसकी वजह से भी कभी कभी हो जाता है। ठीक है, okay, fine. So I hope it is visible in full screen now. So what happens is that the acharyas have told that Shanshodhana, what you have to do, Shanshodhan or Ukshaman has to be done for Prameha Chikitsa. When we look into the journal principles, they have Siddhasya Yogaha, Urdhva Tatha Adhacha. You have to remove the mal from the body, and then once that shodhan is done, you have to give tarpana to the patient. Okay, so it is very clear that whenever we have to practice, you have to understand that whether the patient has arrived in prakupit avastha, or the patient is in the avastha where vyakti or lakshan is observed. And therefore, according to that, you have to create pachana, you have to create dosha movement. And then when you have brought them back into the posture through Deepan Pachan, through Vatanuloman, then what you will do? You will cause the movement of the doshas out of the body with the help of Shodhana Kriya. So that is the theoretical part. I think you already have read it in the book. There is nothing new for from where I'm giving. What new I'm going to give to you is that we are going to discuss three types of cases. These are three cases which have come to the OPD, and these are three very different presentations of Prameha. Usually, what happens is that when we are into practice, rarely a patient comes who is undiagnosed as diabetes mellitus. कि आपके पास कभी कोई ऐसा केस come to the OPD, and these are three very different presentations of. Usually, what happens is that when we are in practice, rarely a patient comes who is undiagnosed as diabetes. कि आपके पास कभी कोई ऐसा केस come to the OPD. Okay, so the case 1 and case 2 and case 3, all these were known cases of diabetes mellitus. They were diagnosed 8 years ago, 2 years ago, and 12 years ago. But the presentation of all three of them were very different. So the first patient was a 42-year-old female, and she was complaining of weight gain along with the frequent nocturnal micturations, generalized weakness, loss of appetite, and was diagnosed as diabetes mellitus 8 years ago, and has been since under multiple medications. So one of the very peculiar feature when you will start practicing will be that most of the patients, or diabetes, it is a kind of disorder that has the feature of resistance. That means you will tend to start with one allopathic medicine, and then what will happen is that the body will become resistant to that medicine. Then you will have to either change the dose, or increase the dose, or add some other type of medicine into it. So most of them were multiple medicated. That means they had started with metformin, now they are taking glimepiride plus metformin, and such combinations with higher doses was presented in these patients. So here you can see that there is a type of a Kafaj profile that the first patient is showing to us. There is gaining in weight, there is frequent nocturnal micturition. That means excess amount of clay is present in such patients. Okay. And the second patient was a 35-year-old male patient, and he was complaining of burning in micturition on and off, with burning sensation in hands and feet, with excessive sweating. So you see, excessive sweating is one of the type of lakshanas which has been told in Prameha by the acharyas. Okay, and he had been taking metformin in higher doses along with glimepiride since the past 2 years. The third patient is a 50-year-old male patient. So here, so in the case 2, I will come to case 2. You can see that is there is some kind of a madhyam avastha of ways there, and the presentation of the patient is a classical presentation of predominance of pitta dosha in such patient. Okay, and the third one is a 50-year-old male patient complaining of generalized weakness and weight loss. Okay, so here the complaints are not as such too much. The patient was actually the father of one of the students who had come, and just he was curious about Ayurveda, so he wanted to try it, and therefore we had he was a diagnosed DM 12 years ago under multiple medications, and the means even after taking a long-standing medications, he was not having such good results. So the borderline HbA1c was always fluctuating somewhere in between. So it had come that, okay, let's see if Ayurved can do something or not. So here you can see that it is 50-year-old, so it is like a Vriddhavastha. Okay, so almost, I mean, it is not classically Vriddhavastha, but the patient has starting to go into that Vata predominant phase of age. Okay, they have told na Vayoratri Bhuktanam Tyanta Madhyadika Kramat. So what happens is that at the end stages of the way, the Vata starts to become more and more predominant, more and more Dhatuksha can happen inside the body. When we look into the journal profile, so the personal history of first patient showed a reduced appetite, improper micturition means because she has to go again and again, and the bowel habits were also problematic because she used to have on and off constipations. The surgical history, now this is very important, especially in cases in female cases. So I would like to add upon this that whenever you are going to deal with any kind of metabolic disorders, just please make sure whether the patient has undergone any kind of surgery or not. Especially in females, if there is any kind of surgery which is related to the apana kshetra, because such kind of because whenever there is kshati or whenever there is ahat, there would be vat and rakta dushti, and therefore may lead to one or the other kind of menstrual disturbances in females, and therefore may lead to other complications, because Acharya Sushruta has very clearly told that disorders of excessive kledha like prameha are not possible in female patients, because every month due to Rajastrava, that excessive kledh gets removed out of the body, and therefore they are safe. And so the male are more what can I say, male are more uh, susceptible to such kind of Santarpanotha Vyadhi. The family history should know any complications of as such. That means, since always remember, whenever you are trying to treat any disease of Prameha, it has been told as Sahaja and Nijabantuj also. So make very sure whether you are treating Sahaja Prameha, because if it is genetic, then you will be practicing and practicing with a lot of medication and combination, getting no result. There are a few combinations that might give results along with diet and lifestyle, but it is very tough, and you have to be very patient with that. Okay. The second one had a history of tobacco and alcohol addiction, and the third one was a very normal person. So, lastly, what we do, Ayurvedic Parikshan is required. So, we did the Dashvidha Pariksha and Ashtathana Pariksha. So, abnormalities were observed in different saratas of different dhatus in all the three of the patients. So, like I said, the first one gave us so first one had a satmita towards Madhura Rasa. So, this was like, okay, fine. The patient is more predominant in Madhura, and therefore Madhura is Prithvi Jala Pradhana. Therefore, it will lead to Guruta, Snigdhata, Shitalta, all these kinds of gunas inside the body, and may lead to Kafaja type of Prameha. The other had Lavanamla, because he used to have those snacks with the drinks that he used to drink every day. So there was obvious Lavana Kshara Amla Gun, Satmita was there. And the third one, along with age, he used to like to eat outside, proper daylight fellow. In Ashtasthana Parikshan, there was Samajiva, Malamutra as usual problem was there. Akriti, she was like short stature and very means Akriti was Sthula Akriti. So always remember, I would like to add upon here that what happens is that you should always look into the prakriti of a patient, because currently the patient has come into a state where he is not well, and he has come to your OPD or to your clinic. So such patient would be not in that prakrut avastha. His prakriti would have changed a bit. So that Vikruti Parikshan will always tell you that what kind of clinical picture this Pramehi patient has. This will be very specifically helpful to you, so that you will be able to decide that, okay, which kind of Santarpan or which type of Aptarpan the patient is suffering from. Aptarpan is usually easy because it is either Ruksha or Stamba, so you can understand the difference. But in Santarpan, you have to understand the difference between the Kapha Santarpan and the Pitta Santarpan. So yeah, Pitta can also do Santarpan, even though it is Ushna. definitely it can cause Santarpanutta Vyadhis. The usual what the acharyas have told, that they have told Mutra Parikshan, that you have to understand the Mutra Parikshan of different type of cases, and then you will be able to tell that okay, by the specific gravity, by the color of the urine, by what kind of ingredients which are present inside the urine, what is the culture of the urine, whether it is acidic, whether it is basic, or if there is some change in pH, or there is some change in the ingredients, there are some protein presence, globulin presence. That is the main part which has been told by the Ayurvedic sciences, because at that time HbA1c was not there. So, in my clinical practice, what I tend to do is that I like to prefer, instead of your blood sugar fasting and PP, because it varies. It varies depending upon what type of food the patient is having, what type of exercises is there. So it tends to vary. So it is better to rely upon HbA1c. It is quite a good marker. So the first one had a 7.1, the other had an 8.4, the third one had a 6.7 HbA1c. The urine routine was almost normal. Now this is another problem that we tend to face, is that because the changes of the color of the urine and the consistency of the urine would happen when the patient is suffering from some one or the other kind of nephropathy or nephrodegenerative syndrome, which is produced by the excessive glucose, or you can understand the clay, which is traveling inside the body and entering into the mutrashay, and out of that it is going outside. So what will happen is that usually the patient takes metformin or some other medication, and therefore the blood sugar levels are, sometimes they are low, sometimes they are high, and the stage when he's going to reach into that nephrotic phase, that will tell you, that will actually be able, or that will actually be visible in urine routine and microscopic, comes very late. By the time the condition has deteriorated very highly, so it is better to rely on the HbA1c. Though you can go for a urine routine also, no problem with that. The type of treatment was given was that the current patient, the case one, is a current ongoing case in which we are in the Vasant Ritu. We had given Vamana to the patient, and followed by that we have given Shivagulika 2 BD with Asanadi Kashai 40 SFBD. So either you can give Asanadi Kashai also, or Ayaskriti also if Asanadi is not present. So Shivagulika is basically Shilajatu, Gomutra and Goghrata. It's, along with other medications. It is a very good formulation and gives, it is a, it is understood that if it is Shilajatu Rasayan, so it is a Sroto Shodhana Rasayan. So the Samprapti that was considered under this type of patient was a Santarpan Samprapti, where there is increase of Kapha dosha, which is causing different types of Sroto Rodha inside the patient. And since because of that, different dhatus are not getting poshan and leading to generalized weakness, loss of appetite, and such complaints. Similarly, Asanadi Kashaya, it is also Kafalekhana. Okay? So, this kind of medication was given. So the patient is currently undergoing medication for the past few months, and very soon we'll see what kind of results are observed in that. Though clinically or symptomatologically, the patient is feeling much better. This is a patient case 2 wherein we had planned for a Virechana. The patient, yeah, I would like to highlight that this woman, we had done the woman with Gmutak. So it has been indicated to some places that either you can use Ikshwaku or Gmutak. So we had given in Gmutak, woman with Gmutak to this patient. The second patient we had given Tiruvutavaleha as Virechana. Once the Virechan was conducted in the patient, followed by that we had started Chandra Prabhavati 2 BD along with Chandra Kalaras, because the patient had complained of some kind of daha. To subside that, we had given Chandra Kalarasa. Nisha Katakadi Kashaya 40 BD, and a combination of Nisha Amlaki tablet was given 2 BD of the patient. Always remember, whenever you are giving this OD BD, try to follow the Ayurvedic methodology, wherein they have told either you should give in Apana or you should give in Praga Bhakta. So better it is Praga Bhakta. This BD is Praga Bhakta. That is in Apan Kal, the medicine was administered. The third case, the patient was given Shaman Sneha in the form of Gugul Tiktak Ghritam, 10 ml OD. So this is a Shaman Sneha, so it is obvious that it should be given when the prior food is completely digested and the patient is feeling hungry. You can give Madhyam or Alpa Matra of Sneha to the patient. हेलो, सोनू भाई मीटिंग में कर रहा हूँ, मैं मीटिंग में कॉल करता हूँ. Sorry. Google Tiktakam Ghritam was given. So when you look into the Falashruti Google Tikta Ghritam, you will find that Prameha is one of the disorders in which this Google Tikta Ghritam, it is Ashtanga Hridaya yoga which has been told. Then along with that Vasanta Kusumaka Ras, it is a Rasayana with Makhan. It was given one time OD, that too early in the morning. Then Jivantari Kashai 10 ml BD was administered to the third patient, and very good results were observed. I will be sharing the results. So here you can see, these are the reports of the patient. Third one. So you can see glycosylated hemoglobin HbA1c was 6.7, and then it got reduced to 5.1. So this is the miracle that you can do. Even though the patient is taking multiple medications from allopathy, he is doing a lot of things, but what has happened is that he is not getting result. Okay, so instead of that, what you are doing is that you are going to give Ayurvedic medicines. You can give formulations, you can give combinations also, which are directly mentioned in the Samhitas: Haritra, Daru Haritra, Bilva, Kapitha, Jambu, Amra. A lot of medicines have been told, and a perfect picture of the patient if you are having. And then when you are using these medicines in a combination or by direct formulations which have been given, like Shivagulika is given, Nishakatakadi is given, Asanadi is given, Ayaskriti is given, Ushirasab is given, then there is Chandanasab is given. A lot of medicines can be used. Different complaints, different medicines. Even we have used Ushirasab instead of Nishakatakadi Kashai in patients who are suffering from Mutradaha, empathic type of Prameha. So these combinations do give a good result. And like I have shown you that we have proof. We have been collecting different proofs that okay, how much HbA1c is reducing, in how much time it is reducing, for what duration, the chronicity of the patient, and for how long we have to keep giving the medication. And so far and so forth, we are getting such and such results. And it is very sure that if you want, you can tell to the patient that yes, okay, fine. If you are giving some Ayurvedic medicine, yeah, you can be sure that yes, if you have decided that it is Kaphaja, Pittaja, Vataja, one or the other type, you can decide, you can give the medication and get the result and tell to the patient that this is the result and this much time I will take and this is how I'm going to pursue and this is the result you are going to get. Okay. So that was my presentation. It was for today's seminar. If there are any questions, doubts, or queries, then you can definitely ask. I hope there is that session over here. Anybody there?
So please, sir, स्वप्निल सर को ज्वाइन कराओगे स्वप्निल सर को ज्वाइन इनके बारे में Thank you very much, Dr. Avinash sir, for a very engaging and mind-boggling session. Thank you for your precious time. Thank you for sharing your precious time and deep knowledge on the efficacy of Panchakarma in management of diabetes. I'm very sure that it's good for our body and others. So now moving on to the next session of the webinar, I would like to invite our next speaker for the day, Dr. Swapnil Modi sir. Dr. Swapnil Modi sir, he is Assistant Professor in the Department of Panchakarma in All India Institute of Ayurveda, Goa. It is a satellite part of India New Delhi, which has been recently inaugurated by Honorable Prime Minister Narendra Modi at Goa. Sir has published around 22 publications. Sir is also a reviewer in JIS, Journal of Ayurveda, manuscripts. Sir is editor in IJIM. Sir has been an eminent resource person in various seminars, conferences, and workshops. Now I would like Sir to kindly begin with this part. Over to you. Over to you, sir.
Hello. Audible? Hello. हेलो
डॉक्टर स्वप्निल सर, आवाज आ रही है आपकी? कंटिन्यू कीजिए सर. डॉक्टर स्वप्निल सर, हियर मी?
यस सर, यस सर.
यस सर. हाँ, आप कंटिन्यू कीजिए सर, स्लाइड चला लीजिए. आपको हाँ, आपका कंटिन्यू करिए सर.
हाँ, मैं
आपकी आवाज आ रही है, क्लियर आ रही है.
हाँ, स्लाइड से वो अपलोड हो रहा है.
हाँ, आप ऐड कीजिए, स्लाइड शो कीजिए सर.
अपलोड हो रहा है. वेट मिनट. हाँ. अपलोड शायद कुछ शेयर स्क्रीन कर दूं क्या मैं? ये अपलोड
हाँ
शायद.
सर, ये प्रेजेंट लास्ट नीचे में लिखा हुआ है सर, प्रेजेंट.
हाँ हाँ, वो कर दिया.
प्रेजेंट में शेयर स्क्रीन.
ठीक है, ओके.
विंडो सर, विंडो कीजिए सर, मैं चेक कर रहा हूँ.
विंडो कर रहा हूँ. ओके.
नो आया सर, नो रिस्पॉन्स सर.
आ गया.
या
Okay. So, yes, I think it is visible now. Yes. First of all, I would like to thank and congratulate Ishan Ayurvedic College for arranging such a wonderful webinar series, which is a great opportunity for the students to gain the knowledge and as well as a good educational activity also. I would like to thank Dr. Avinash also for giving a very elaborate and informative lecture on diabetes mellitus, which is mostly the clinical oriented. So I will be sharing some of the parts which are most of the dependent upon whatever the Dr. Avinash told regarding the clinical aspects of the Panchakarma. So I think it is visible. My PPT is visible. One minute. Huh? Is it visible?
No sir, not visible.
One
sir, remove this and kindly again sir add the PPT.
Okay.
Yes sir. Yeah sir, below in the screen present sir, plus present. Click down present. Share screen.
It is already sharing.
No sir, already it's a Chrome tab, not entire, only window sir. You can share only window sir. Okay, 3 button as the Chrome tab, window, entire screen.
Window so, is there.
Only scare then window.
Okay.
Window. Yeah. Just
Is it
now.
visible now?
Yes, sir. Very good. Sir, kindly show the slide, sir. Thank you. Okay, sir.
Okay.
Visible, visible.
Okay. Okay.
Okay,
So,
sir.
the first of all, I would like to introduce myself. I am Dr. Swapnil Lauti, Assistant Professor in the Department of Panchakarma, All India Institute of Ayurveda, Goa. Coming to the presentation, we have gained a lot of knowledge regarding diabetes through the previous presentation. So, just I'm focusing on whatever the clinical aspects of the diabetes, which are very much important for a practitioner. So, diabetes is not just raised sugar. We consider diabetes and we look to the diabetes with its complications like stroke, heart attack, the peripheral artery disease, various retinopathies, or the nephropathies, or neuropathies, or the glaucoma, cataract, and diabetic foot is one of the clinical conditions that we face. So, treating the diabetes is very much possible, and treating the complication is also possible with Ayurveda, provided we follow the principles of Ayurveda in a correct way. Now, why diabetes is such a serious problem? It is nothing but increase in the blood sugar. Na? So, why we consider it as a big problem is because it is basically a silent killer. Whenever patient comes to know that he is diabetic, most of the time he is there somewhere in the laboratory of a hospital or somewhere in the ICU. Till that he never knows that he was having diabetes. Till he get some symptoms of some other diseases. So it is considered as a silent killer, and occasionally because of some other disease we come to know that yes, my blood sugar is raised. So it is one cause, and many diseases or multi-system involvement is there. This is the main issue because of which it is difficult to treat. Whenever the patient comes to OPD, he never comes with a single thing, that is, I am having diabetes. He comes with some of the other clinical complaints like I am having burning micturition, or I am having some excessive urination or burning in my legs, something like that. So, whenever we start the treatment is usually unending. I'll come to this point why treatment is unending, because we claim in Ayurveda that we treat the diseases from the root. If we are treating the disease from the root, then why the treatment should be unending? In Ayurvedic also, most of the time patient have to go through the treatment for his whole life. So this is the tragedy. That was somewhere we are missing something that we should focus on while treating the diabetes. Now this is the statistics of India. As you can see the lines, these are the lines related with the prevalence of the diabetes and prevalence of the pre-diabetes. As you all might be knowing that diabetes we consider when blood sugar is above somewhere 126 and other on fasting level. But if it is above 100 and between the range of 126 and 130, then we call it as a pre-diabetic stage. Okay, same with the case of postprandial blood sugar. So the percentage wise, if we see in the prevalence rate, the prevalence of this pre-diabetes also is nowhere less in India. It may be more than whatever these lines are telling. This is 15%, approximate 15% prevalence of the diabetes is there, which is the very huge population of India. If we consider we are 100 crores, then the 15 crore patients are there with pre-diabetes and 15 crore patients are there with the diabetes. So there is a great opportunity for the clinicians to practice. If you start your practice on only diabetes, you will be a successful practitioner. So that's why I'm showing you these statistics. Now coming to the clinical spectrum of the Ayurvedic management of diabetes. So as I was telling, whenever we start with the Ayurvedic herbs or Ayurvedic medicines also, most of the time it is also unending, as similar to the allopathy. Why this is? Because we never follow this pyramid. I hope it is visible. In this pyramid, you can see that first and topmost treatment of diabetes is lifestyle modification and not the medicine. See, second comes is a diabetes diet management. Then comes the part of Shodhana Chikitsa, or what is today's topic, that is Shodhana Chikitsa Panchakarma treatment. That is third part, and then comes the number of these drug therapies. Drugs means herbal or herbo-mineral formulation. I have kept yoga, exercise, pranayam. It is somewhere next to that, and rasayana, the last and ultimate treatment that we can give to the patient. But see, whenever we start with the treatment, what we think is that if we are giving some Mamejwa Ghanvati or we are giving some Vijay Saradikvat or something like that, patient will be cured. But see, that never happens always. Whenever the patient takes the medicine, blood sugar comes down by 20 or 30 points. Then patient will be happy. Yes, my sugar came from 300 to 250. Okay, I'm happy. But patient wants what? He wants complete cure. The complete cure is dependent, and it is possible only if we follow these three top three constituents of the pyramid. That's it. First is lifestyle modification. If patient cannot modify his lifestyle, he cannot be cured with the Ayurvedic treatment also. Correctly said by Dr. Avinash, and what is written in our Samhita, that diabetes mellitus, that is type 2 diabetes especially, is a apatya nimittas prameha. So the treatment should be pathya. So because of that, this lifestyle modification and diet, they have to be given the prime importance, and then comes the number of Panchakarma treatment and the drug therapies. So if we do all these three, then definitely there is a possibility that diabetes can get cured, dependent upon the severity and dependent upon the chronicity of the disease. Okay. Now coming to the lifestyle modification, Acharya Charak also has told that if patient is not having money to treat the diabetes, then he should dig a well. That means he has given prime importance, or he's given his focus on regular exercise and regularly doing all the physical, that is strenuous physical activities. That is important. That's why I have kept this yoga pranayam separate, and the physical activity to be given the prime importance, that to the vigorous physical activity. Now daytime sleep and proper sleep in the night, the increasing the activeness, continuous avoiding the continuous sitting at one place, and avoiding the holding the urine, because diabetes is the mutrava srotas vikar. So we have to consider all these things. Avoid smoking, because we consider it as a constituent of vataja prameha somewhere. So these are the modifications which are very much necessary before starting the treatment with Ayurveda medicine or Ayurvedic Panchakarma. So you have to be sure with the patient that if you want to get cured with Ayurvedic treatment, then you have to follow all these things. Then only I'll go to the complete cure. Otherwise, I'll manage it. So that is the difference while treating the patient. Now see, whenever you are looking at the patient of diabetes mellitus, see, whenever we are treating hypothyroidism, there is no disease like hypothyroidism in Ayurveda. Right? So we consider the clinical presentation of the disease. According to the clinical presentation, we come to know which dosha is predominant. Similar thing we have to do for diabetes also. Ayurveda in Charak Samhita or all the other Madhav Nidana, all they have clearly mentioned the three types, that is Vatas, Pittas and Kaphaja Prameha. But there is no mention of this diabetes mellitus separately. Na? So whatever the entity that we are dealing clinically, that may fall in any of these categories. Simply, if you focus on these three symptoms, we call it as 3 P's of diabetes. In Viva, whenever your teacher asks you what is 3 P's, these are polyuria, polyphagia, and polydipsia. So just see through the angle of Ayurveda once. If you are having polyuria is what? Mutrasya excess pravritti. Okay, so mutrasya karya is what? Mutrasya kleda vahanam. So here kled is increased in the body. That means somewhere kapha related something is increased in the body. So if patient is having dominantly polyuria, then we should consider it in a kaphaja type of the diabetes mellitus. I am telling diabetes mellitus in kaphaja. Okay, then polyphagia. If patient is having polyphagia, now you might have gone through the chapter Sthaulya. If you read Madhav Nidana, they have written that Medasavrita Margatvat, कोष्ठे वायु कोष्ठे विशेषतः चरण संदुक्षयति magnim aharam shoshayatyapi. So there he clearly mentioned, though kapha is increased in the body, meda is increased in the body, still vayu get avrit, and because of which patient gets polyphagia. Here also same thing is happening in diabetes mellitus. Kapha is increased, body is having sugar, but it cannot use it. That means there is somewhere avrana is between in between the body's energy utility mechanism and the blood sugar. So blood sugar cannot be used. That means there is avrana of vata, and that's why we can see vata if patient is having polyphagia as a main symptom. I'm focusing on these 3 P's. There are many other symptoms which points towards the vata, so we can consider it clinically. Now, polydipsia. You all know that atyadik shudha or atyadik trusha. Whenever patient is having atyadik trusha, that is polydipsia, we simply see to the 2 guna of Vimshati guna. That is, if daha is increased or ushnata is increased, then patient will feel polydipsia. Another is rukshata. If rukshata is increased, then also patient will feel polydipsia. So basically, from the below mentioned shloka, you can see that kapha, pitta, pavanascha dosha. So these all the 3 dosha can be involved in Vimshati Meha. I can read it like kapha pitta pavanascha dosha medostra shukrambu vasalasikaha majja rasojah pishitam cha dusha pramehinam Vimshati reva meha. If I read it like that, ki Vimshati reva meha means all the 3 types of the prameha, these 3 can be there. That is kapha, pitta, pavanascha dosha. Okay. So dependent upon the clinical presentation, we have to treat, not depending upon our books. That is, Vataja Prameha is equal to diabetes mellitus. It is not like that. Most of the time, the initial stages of the disease, it is mostly Kaphaja type. Okay, the symptoms are Kaphaja type. You have to treat the Kapha Pittaja Prameha there. You should not focus on the Vataja Prameha. In later stages or some stages of the diabetes, there is a Vata dominance. There you have to go for Vata treatment. Okay. Now I'll just give one example. Not focusing on diabetes, I am focusing on complication of diabetes. That is diabetic retinopathy. To understand, it is very simple. Diabetes retinopathy is having 3 stages. The topmost figure you can see here, there are some soft exudates. These exudates are prepared from cholesterol and some liquid part. This is just a leakage that we can see in the eyes of a diabetic patient when he go for the retina examination. Okay, so this I can correlate with the kapha, right? I don't know that just going through the shloka is essential. We can see the Vat Pitta Kapha on our screen also, right? Now see, if patient is having this stage, the proliferative diabetic retinopathy stage, there you can see the multiple blood vessels, which are usually high in number. Okay, unusually high in number. That is the neovascularization. Neovascularization meaning what? The division of the vessel is so fast that the vessels which are formed, they are very fragile and they tend to break very easily. Okay, that is called as a neovascularization. As we see in the case of psoriasis, what happens is skin cells multiply very fast, but the skin cells that are formed, they are not perfectly all right. They are disease cells and they tend to get dearranged very easily, and because of which we see the scaling on the patient's skin. The same thing or same principle we see there, Vata and Kapha disorder. Okay, with the same principle we can see here Vata. Okay, also as it is involving the blood vessel, I can see the Rakta also. Okay, now see the this one, the picture on your left side. That is you can see these arrows. In this arrow, that is actually blood. It is a large pre-retinal bleed from an abnormal new blood vessel from the retina. These are the vessels which have broken down and this blood is accumulated in the retina. Now this is the stage where I can assume or I can go for the Rakta Pitta chapter of the Charaka Samhita. This is the Rakta Pitta Avastha or Pitta dominant Avastha of the disease. Okay, so with this view you have to proceed further while you are treating the diabetes patient. Okay, then only your Panchakarma treatment will be proper. Now see, we have the simple classification, Sthula Pramehi and Krisha Pramehi. Now in what is the relation of this obesity, why Acharya Charaka have focusing much on this obesity? You can see all the chapters, like in Yoga Ratnakar also. First chapter is Prameha, second chapter is Medoroga. In this thing, Madhav Nidan also, first chapter is Prameha Nidan, second chapter is Medoroga Nidan. So why these are in sequence? Acharya Charaka has given another sequence, like that is Atisar, Grahani, and Arsha. So similar sequences here also, that is diabetes and obesity. These are somewhere interlinked. So because whenever the abdominal fat is increased in the body, the fat cells are considered as a pro-inflammatory chemical, and they release some pro-inflammatory chemical which can make the body less sensitive to the insulin. That means the insulin resistance is developed because of the pro-inflammatory chemicals which are released by fat cells. Okay, now there will be also the disruption in the fat metabolism. Like for example, if your blood sugar is high, ideally the sugar should get converted into the fat cell, but what happens is your cell is actually fasting. There is no enough energy to the cell, so because of that, fat get dearranged, fat get metabolized, and that fat get utilized for the energy production, because of which the old standing diabetic patient, he tend to become thin also. That is a krisha pramehi avastha of the diabetes, which is very difficult to treat. I'm telling you that it is very difficult to treat than the obese diabetes. Obese diabetes is better to treat because of the samana dusha or samana dosha involvement. But in krisha diabetes, it is very difficult to treat. Now, there are increased possibility of the complication. For this, I'll show this slide, that is metabolic X syndrome. That is, whenever patient is having diabetes along with hypertension, along with abdominal obesity and raised cholesterol. That means patient is possibly will be having somewhere to some sort of the heart disease or stroke. So all these things are interrelated and interlinked on metabolic level, because of which this endocrine disease get affected with the metabolic syndrome, and the body get tend to involve in a series of diseases which involve eye, which involve the cardiac tissue, which involve the brain tissue, which involve the kidney tissue also. So because of which diabetes is not that simple disease as we consider it, not just the raised sugar, it is somewhere it is very beyond that. Now see, Ayurvedic treatment principle, it is separate for the obese diabetics and thin diabetics, because in obese diabetics there is some apatya nimittaj, or there is something which is high in the body, we have to reduce it. In thin diabetic, there is something that is less in the body, and we have to provide the nutrition to the body without increasing the kapha. So very difficult to treat the thin diabetic and very easy to treat the obese diabetic. Okay, now see, these are the therapies that we generally do. That is Vaman, Virechan, Basti, certain type of the Basti. In Acharya Charaka only I given one Basti a chapter, so very less used but very effective in the diabetes complications. Basti therapy can be used in complications of diabetes where Vata involvement is predominant. Nasya is also helpful in some cases of diabetes. For example, as I was telling about this ocular disorders. In ocular disorders, Vamana Virechana is most of the time contraindicated, because you know Timira is a contraindication of Vamana. So if we are going to do Vamana in Kapha dominant stage of this exudate of diabetes retinopathy, then that is somewhere difficult. So in that stage, we can use Nasya therapy, which we can use the Rachel type of the Nasya that will be helpful for remove the Kapha. Okay, so Rakta Mokshana also. Rakta Mokshana is also helpful in some of the skin involvements of the diabetes. For example, if patient is having diabetic foot ulcer, or patient is having diabetic carbuncles, okay, in those cases we can use the Rakta Mokshana also. Now see, what these Panchakarma therapies basically do to the body. First of all, if we are considering obesity as a friend of diabetes, then it helps to reduce the weight. First of all, then it increases the insulin sensitivity. Whenever you are doing Vamana or Virechana, a strong Vamana or strong Virechana have shown to affect the insulin sensitivity. You can check it clinically if blood sugar is reducing without any medicine. That means somewhere the insulin sensitivity is targeted. Now it also helps to cure the lipid abnormalities. So whenever you are doing Snehapana itself can reduce the blood cholesterol level, because whenever you are administering the lipids, then body try to counteract it, and body's mechanism to counteract the lipids get activated, and because of which whenever there is a Adhastar Snehadarshan, after that you are doing the blood sugar blood cholesterol reports, and you can clearly observe that the blood lipids are reducing after the Snehapana. Now one main thing is that whenever we are doing Vamana and Virechana or any type of the Panchakarma therapy, it is a common treatment for various disorders. That is the beneficial thing of Ayurveda. Now, whenever I am seeing the patient of diabetes, what happens is common problem with our clinicians that patient comes to us with joint pain. Then he tells that he is having somewhere hair fall. Then he tells that he is having indigestion also. Then he tells that yes, he is having some skin problem also. And then he tells that yes, I am having diabetes also. Then if you are doing the treatment and you are writing the prescription as per the disease, minimum 10 or 12 drugs will be there. So it is not feasible and it is not correct according to the Ayurvedic principle. So there has to be a single medicine which is having multiple action of spectrum, multiple spectrum of effect. So Panchakarma therapies are like that. If I am doing Vamana, it can cure your diabetes also. It can cure your endocrine disorders like hypothyroidism. It can cure your skin diseases also, and it can cure some problems like Kalitya, Palitya, etc. So it is better to advise the patient that yes, you are having multiple problem, go for the Panchakarma instead of going for some Ayurvedic medication for diabetes. Okay, so it is a doctor friendly treatment. That is my advice, that Panchakarma treatment is doctor friendly to do the good clinical practice. Now, it also acts as an anti-aging therapy. I will concentrate on this point very well because I consider diabetes as an age-related disorder. Because, see, in 90% of the cases, diabetes occurs after 40s, after patient attains the age of 40. Juvenile diabetes is completely a different disorder that we cannot compare with the type 2 diabetes mellitus. So I am keeping it aside and I am focusing on 90% of my patients. That is, it is a problem of old age or a problem of adulthood. That is the avastha called as a proud avastha. Okay, so in that stage, we get this disease. So anti-aging therapy is very essential. Now see, when I go through the Charaka Samhita or any authentic classical Ayurvedic text, they have said that Haridra and Amalki, these are the Agriya of diabetes. And answer me very means properly that how many of you are using Haridra and Amalki for the blood sugar lowering purpose. It is not actually the blood sugar lowering drug. It has activity, that is hypoglycemic drug. These are hypoglycemic drugs, but not to that extent that you can compare it with the glibenclamide or any other type of the insulin injections. Okay, it is not that potent. But why Acharya Charaka has given it a prime importance and he has ignored all the medicines like Karela, Vijaysar, Mamechak. These are better than Haridra and Amalki in controlling the blood sugar, but still Acharya Charaka have focused on Nishamalki, that is Haridra and Amalki. Why? That is the question you should ask to yourself, and here lies the answer. That see, whenever I am telling that patient is getting diabetes in his 40s, what happens in his 40s that whenever the age is aggressing or age is advancing, what happens is the oxidative stress is getting developed in the body. Means the free radical. Free radical is what? A molecule which is having an excess electron or excess of the component that can be connected to the other type of the cell, and there will be a body formed which we call it as a oxidative damage to the body. Okay, so our body is having one organ, that is pancreas. Pancreas is deficient in free radical scavenging antioxidant enzymes, because whole body is having some enzymes, that is, you can see these names, that is catalase, glutathione peroxidase and superoxide dismutase. These are the enzymes which take part in the antioxidant activity of the body, and your pancreas is deficient in these chemicals. So because of that, pancreas get very easily affected by these free radicals, which are oxidative stress causing agents. Okay, because of this, the pancreas become ill. It either kills the pancreatic cells or it develops some chemicals or some reaction in the body which causes the insulin resistance. Okay, and because of this insulin resistance, again the sugar increases in the body, and this sugar, again increasing of the sugar, causes the excessive production of the free radical. and this excessive production again causes a vicious circle. So because of this, the diabetes keep on increasing as your age advances, and if you are not treating it properly in Ayurvedic way. So that is why Dr. Avinash was telling that the drugs keep on changing, the drug doses keep on changing, and drug dosage keep on increasing. The oxidative stress is one of the important cause. And whenever we see through the angle of Ayurveda, this oxidative stress that can be treated with rasayana therapy, because all the rasayana that are mentioned in Ayurveda, they are basically antioxidants. They are basically antioxidants, because of which we can treat the diabetes very well, and because of which Charaka have told that Nishamalaki as a prime drug. Now coming to the Panchakarma therapies. Being a Panchakarma physician, my oxidative stress therapy should be Panchakarma. Okay, so we have tested that whether these Panchakarma therapies are also having any action over these enzymes or not. So we found that, see, we can clearly say that we have given one basti to the patient. The basti was prepared of rasayana drug. Rasayana drugs are drugs from the rasayana churna, that is gokshur, guduchi, and guduchi, gokshur, and amalki. Okay, so these rasayana drugs were given in the form of basti, and we can see clearly that catalase activity is increasing, the superoxide dismutase activity is increasing, and see this lipid peroxidation, that is decreasing, that has to be decreased. The lipid peroxidation is a part of oxidative stress, so that should decrease. So in that way, our Panchakarma therapies are directly acting over the free radicals that are harming or that are affecting the pancreas. So in this way, we can say that Panchakarma therapies are very much effective at the root cause of the diabetes, right? So now, one of the second part of this pyramid of diabetes treatment was diet. Now in diet also, we should focus not on the glycemic index of the drug or glycemic index of the food, but we should focus on how it increases the insulin sensitivity, how it is effective over the diabetes, how it is effective over the obesity or on the autoimmune disorders that are associated with the diabetes. And nutrition should not be kept secondary. Nutrition of the body has to be maintained. In Ayurveda, there is a two diet regimen. Two diet regimen is very effective in management of diabetes as per the latest report, because there are another thought process or another thought of the from the scientists that grazing is good, that is multiple time eating with a low amount of the sugar, that is also helpful to maintain a steady sugar level. But whenever you are eating something, the pancreas has to work, pancreas has to release the insulin, and because of which pancreas get exhausted if you use the multiple diet regimen. So Ayurvedic regimen of two diet is very helpful, if because it relaxes the pancreas and it removes the load over the pancreas, and pancreas damage can be somewhere checked. Okay, now see, this is the ideal thing that we can give to the patient. I'm not focusing much on this because we are mainly have to focus on Panchakarma treatments. Now, these are some of the therapies that you can tell your patient, that intake of the water that is treated with Vijay Sar. Vijay Sar is simply available in the form of glasses, or the wooden woods are available that you can immerse into water, and you can make the patient to drink this water only. Now see, these are some of the combinations. Like in South India, there is a great, it is a diabetes capital of India, but still see, there you can see their diet regimen. The rice quantity is very less. There are so many vegetables, and most of them are kattu tikta kashaya rasa. And because of which, the overall carbohydrate that is going into the body is greatly reduced. And similarly, if you are using amla rasa in the diet, that is also helpful. It reduces the absorption of the sugar. Now coming to some of the cases which I would like to focus on with the help of Panchakarma therapies. Now see, common complication of diabetes is retinopathy. Whenever patient is having diabetes, we tell him that you should get your retina checked once in a year. So why we tell that? Because of this, because of the retinopathy. You have seen the three stages of retinopathy just now. So with the Panchakarma, we can treat it very well. I have come across some cases of the diabetic retinopathy where you can see this case. Now this is the retina thickness map. We call it as a OCT report, where you can see this red part. I think it is visible to all. One eye is having complete red part. This is completely blindness of the patient. Patient was completely, means more than 70% blindness was there, and this is because of the macular edema. Macula is a part of eye. Whenever there is a exudate formation, whenever there is a leakage of the fluid, this macula get swollen, okay, and because of which patient get a loss of vision. Now it is very difficult to treat with the medicine only. So what we did is, we started some Ayurvedic regimen internally, and along with that, we gave the patient some mukhalepa. Okay, the mukhalepa, though it looks very simple, but it has some local action. It alters the blood flow that is exactly going to the eye. So because of that, this thing got reversed, and you can see the changes that this figure. Okay, here you can clearly see that the reduction in the macular edema. Now, if it is not understood by you, I can simplify it this way. Okay, this is the picture where you can clearly see before treatment. This was the picture of macula. The macular thickness was very high. Macular thickness was very high, and after treatment, you can see that the macula was somewhere reduced. Okay, the thickness of the macula was reduced. So this is the change in the curvature of the macula. What we thought in this thing, that if macula is getting edematous, we can compare it with the Shotha. I opened the chapter of Shotha in Charak Samhita and I treated it accordingly. Okay, you can see in Yoga Ratnakara there are many mukhalepas available for the Shotha Chikitsa. Okay, mukhalepa or general lepa. So you can use it as a mukhalepa, or you can use it on a vidalak. Okay, so in the form of vidalak you can use it. So this definitely reduces the macular edema. Now see, this is another case. There was a vitreous hemorrhage. Now I told you that vitreous hemorrhage, that is bleeding inside the eye, can be compared with the Rakta Pitta Avastha, and definitely it is a Tiryak Rakta Pitta. Tiryak Rakta Pitta is incurable. So I considered that yes, my patient is not curable. But still, if patient is coming to me and there is no option left with him, because what is the treatment in allopathy is, they give the injection of growth hormones, and they do the laser therapy to burn this blood that is collected in the eye. And gradually what happens is, this you can see this yellow thing. These are the markings created by the laser therapy. These are the markings by laser therapy, and it actually damages the retina. So, and the frequency of the laser therapy also increases as the disease advances. So to control that thing, what we did, we considered it as a Rakta Pitta. And what we started the Nasya of what? Durva Swaras. Durva, you all know, it is common herb, and Swaras you can freshly prepare, and you can administer the Swaras of Durva. So at least 5 to 6 drops per day in each nostril you can give, or depending upon the tolerance of the patient, because some patients I have seen, they can tolerate up to 1 ml of the fluid of Durva Swaras in their nose. So you can definitely give them as per their tolerance. Try to give the maximum dosage of Swarasanasya. So because of that, it is having Rakta Stambhaka activity, it is having the Shita Guna, and it is having the Pitta reducing activity, and also Durva is good for diabetes. The Durva is favorite of Lord Ganesha, which is a idol that we consider as how diabetes patient looks. Okay, so whatever he likes, that is actually the treatment of diabetes. He likes Kapitta, that is a good fruit for diabetes. He likes Jambu, that is a good fruit for diabetes. And similarly, he likes Durva. Durva is also a good treatment for diabetes. So we tried the same thing, and you can see in the second figure, the below one, that his retina is clearly visible. Even you can see the laser marks which are not visible in the initial picture, and blood is completely removed. However, I would like to mention here that the disease was not cured here. Disease was Yapya. I got the disease from Asadhya category to Yapya. Patient was coming to us again and again, and I have the follow-up of this patient for 3 years. 3 years we were treating him, and the necessity of this laser was increased. I'm not telling that the laser was completely removed. Patient initially was doing laser therapy every 3 months. Then when he started this Ayurvedic treatment, then first treatment of therapy, he never required his laser therapy for 6 months. So that is a great advantage that we can achieve, and you can prevent his eye from the loss of vision. So that is a great success with Panchakarma therapy, that is Nasya. Now see, this is one of the important problem that commonly we face, that is neuropathy, diabetic neuropathy. Okay, patient comes with three main symptoms. Some patient complain that yes, I am having numbness in my legs. I cannot means he never knows whenever his slippers get off from his legs. Okay, so patient is unaware of that. That means there is a supta avastha. The supti is there in two dosha, that is vata and kapha. So basically kapha involvement is there at most of the instances and vata involvement is there. Some patient complains of burning sensation in the feet. Okay, they sometimes they feel burning, sometimes they feel cold in their feet. So that is the avastha of pitta and vata involvement. So considering these clinical presentation, you have to decide the treatment. So I have given all these options, that if patient is telling that I am having some vata dominant symptoms like pain, you have to go for Shirbala Tel Dhara, okay, or any such type of the dhara. Even you can select if you are confused whether it is vata or it is vata associated with kapha, then you can use some oil like Karpa Sasyadi Tail or Kottam Chukadi, which is effective over the vata and kapha also. Now, if patient is complaining of pitta, patient is complaining of burning sensation, then you can clearly go for Shiradhara. Shira may be made siddha with guduchi or any other drug. Then if patient is complaining of supti and you can feel that patient is having kapha dominant symptom all over the body, then you can go for Dhanyamla Dhara. Dhanyamla is a kanji that you have to prepare. If you are not having this readily available, you can use vinegar diluted with normal water. So that also can be used as a dhara dravya. Now, some patients comes with this sukti. It is indicating kapha dominance, then we go for local application of lepa with haritaki and gomutra. Haritaki is very good drug mentioned in Ayurvedic classics, which is having medo hara, and basically the mamsa cleansing activity, mamsa and meda cleansing activity. And as you know, Triphala is a prime drug in ocular therapies. So in eye there is a medo ashrita patal, and there is mansa ashrita patal. So basically haritaki is having action in Triphala, which acts on this meda ashrit patal and mansa ashrit patal. So because of that same principle, we are applying haritaki in case of this diabetic neuropathy, whenever patient is having supti or whenever his patient is having kapha dominant supti. Okay, and if patient is having vata dominant feature, then you can go for Shatadauta Ghruta. It's very well confusing. I know that supti, to differentiate whether it is vata dominant or it is a pitta kapha dominant, you have to differentiate it clinically, seeing other features of the disease. Okay, so if patient is having some type of the neuropathy and that is not responding to the your lepa, then do exact opposite treatment. Go for the Shatadauta Ghruta Abhyanga. I have given in many patients the Padabhyanga with the Shatadauta Ghruta, and it is very effective in managing these symptoms. It reduces burning also. It can be used in the Pitta dominant stage also. So similarly, Viduchi can be applied as a lepa along with Pravada in these cases of whenever there is symptom of burning. Okay. Now, coming to the very major disease or major complication of the diabetes, that is nephropathy. Now, see, whenever nephropathy is there, patient rarely come to the Ayurvedic OPD. Yes, because nephropathy is a serious condition. Patient generally goes to the nephrologist. Nephrologist puts him on steroids. Steroid is very good treatment in nephropathy, managing the nephropathy, but the problem lies where? Problem is that steroid increases the sugar, right? Steroid increases the blood sugar. Patient sugar is going to get increased. Then it never stops with one course of steroids. Patient generally goes for the one course of 2 or 4 months. 1 minute. Yes, sir. 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 Okay. So, whenever you are treating this nephropathy, you have to think of vata because damage is caused because of the vata in the kidneys. So, considering the vata dominance, we plan for the basti therapy. So, these are the reports I have to just show. This is a proteinuria. This is one of the different case. It is a nephrotic syndrome in diabetic patient. You can see clearly the proteinuria 330 level was there in protein. Urine protein creatine ratio was also near to 4, which is very damaging to the kidney. And you can see the cholesterol level and the triglyceride levels and all these are increased because of the damage to the kidneys. Now see, when we treated it with the Gokshur Punarnava Basti, now these are the results. What I was telling is you should use the basti that is apatarpaka in nature. Any type of the basti that is disease specific that you can apply in the diabetes if it is indicated, if you are feeling that vata involvement is there. So you can see clearly the changes that are happening. Now see, this is microalbuminuria. It is also one of the complication of diabetes. You can clearly see the difference that is happening with same, that is Gokshur Punarnava Basti. This is paper of my senior that he has presented. You can clearly see the difference. The microalbuminuria is reducing to the almost it is reducing to the 1/3. Okay. Now this is common picture that we find, that is a diabetic foot ulcer. So Panchakarma therapy, that is Jaloka Avcharana, Rakta Mokshana, that can be very well applied, and these are the results. These are the clinical results. Complete healing occurs with the Panchakarma therapies. It is better than any antibiotic, our Jaloka Avcharana. Okay, now this is the potential that we have seen with the Panchakarma therapies. Whenever we are giving some Basti therapy, now see, this is the liver of a rat which we gave the extra pure cholesterol orally, and his liver got damaged, and Basti is considered to be the marma karma paripalanam. Okay, so whenever we gave Basti to the diabetic, this cholesterol induced rat, you can clearly see how it protected the liver. So this is how the Ayurvedic Panchakarma therapies protects the soft organs or protects the marma, and that is what I would like to focus, that our Panchakarma therapies are basically having protective action and curative effect over these organs which are targeted by this and this oxidative stress. So we can clearly observe there is no damage in these treated rats, and there is a lot of damage in the rats that are treated with the cholesterol. So this is the means I would like to focus that diabetes is actually a challenge to you, that how you can be a good clinician and how you can explore yourself. It is a challenging disease, and it gives a real pleasure of the treatment when you cure a diabetic patient completely. So thank you. Any questions?
Thank you so much for sharing your cases. I'm very sure our students and the audience watching this live will be extremely benefited with your Thank you so much for sharing your cases. I'm very sure our students. Now, to move on to the further session, I would like to invite Associate Professor Department of Panchakarma. I request sir to kindly come over the rise for a small demonstration for our
आज हम क्लास के सामने आप सभी पंचकर्म और पंचकर्म में स्पेसिफिक जो है उसका रोल उसकी संप्राप्ति करने के लिए कैसे कर सकते हैं तो उसका मैं थोड़ा सा पहली बात करूंगा उसके बाद उद्वर्तन करते कैसे हैं उसका डेमोन्स्ट्रेशन किया अभी तक आप काफी दूर हो गए थे और अभी हमें थोड़ा सा 5-10 मिनट ऊपर हो जाएंगे 4 बजे से करता हूँ हम लोग यहीं पे हमारे साथ तो मैनेजमेंट ऑफ मधुमेह जब हम मधुमेह की बात करते हैं तो उसमें स्पेसिफिक रोग क्योंकि टाइम नहीं है इसलिए मैं ज्यादा शॉर्ट में जा रहा हूँ क्योंकि डेमोन्स्ट्रेशन का मेन पर्पस है तो जब हम मधुमेह की बात करते हैं तो इसमें जो संप्राप्ति है उसमें अपत्य निमित्त रोग मधुमेह जो कि संक्रमण है संक्रमण की वजह से है एक्सेसिव फूड हैबिट्स में चेंज जो लाइफस्टाइल सेडेंटरी लाइफस्टाइल वगैरह की वजह से और नेक्स्ट है सहज मधुमेह सहज से मतलब है जेनेटिक फाइबर और उसके बाद धातु से किसी बीमारी की वजह से लाइफस्टाइल की वजह से खान पान की वजह से ही अगर बात की वृद्धि होके धातुओं का उत्तरोत्तर क्षय होता चला जाए और मधुमेह की संप्राप्ति बन जाए तो ऐसी कंडीशन में हमें दो प्रकार के रोगी देखने को मिलते हैं स्थूल और बलवान ऐसा रोगी जो स्थूल है और बलवान है स्थूल और बलवान रोगी में संप्राप्ति जनरली देखी जाती है वो वात का आवरण होता है कफ और पित्त के द्वारा और इसमें जो चिकित्सा होगी वो अवतरण चिकित्सा होगी। स्टूडेंट्स इधर उधर टेबल पे कुछ नहीं है अभी। इसके बाद सेकंड पेशेंट है क्योंकि जो मैं बता रहा हूँ इसी से ट्रीटमेंट आपका डायग्नोसिस करके और आप ट्रीटमेंट बनाएंगे चाहे वो उद्वर्तन ही हो। क्रश एंड परिदुर्बला रोगी ऐसा रोगी जो क्रश है और दुर्बल है इसमें धातु क्षय होगा और ये अपकर्षण जन्य मधुमेह है जिसमें हम संतर्पण चिकित्सा करेंगे। ओवरऑल अगर हम देखते हैं तो जब संप्राप्ति बनती है मधुमेह की तो उसमें हमारी बॉडी के जो पार्ट्स हैं या कि उनके जो लाइक एसोसिएटेड ऑर्गन्स के जो भी रसद हैं धातुज हैं या जो भी धातुज हैं जो कि दुष्टि होते हैं वो ये हैं अग्नि क्षय होता है पहले आम फॉर्मेशन स्रोतोरोध आवरण मेदो वृद्धि धात्वा अग्नि क्षय एक्सेस क्लेदोत्पत्ति एक्सेस मात्रा में मूत्रोत्पत्ति और दुष्टि ऑफ धातुज और जो कि धातुज ये हैं के नाम दिए हुए हैं। अब प्रमेह चिकित्सा की हम बात करते हैं तो इसमें स्पेसिफिकली जो चिकित्सा है वो मैंने पहले थोड़ा सा बता दिया है। नेक्स्ट श्लोक बता रहे हैं वो कह रहे हैं सस्तम उल्लेखनम तत्र विरेको रोक्षणम यानी कि यहाँ पे लेखन का मतलब है कि यहाँ पे वमन और लेखन यानी कुल मिला के लेखन कर्म हमें करना है। इसके बाद दिया है स्वेदनानी स्वेदन का प्रयोग करना है संशोधन उल्लेखन लंघनानी उल्लेखन यानी कि फिर से वमन लंघन और लेखन लंघन। नेक्स्ट है जो ग्रहण जो कि पेशेंट स्थूल है और बलवान है उसमें हमें कर्षण चिकित्सा करनी है और जो कर्षण वाले रोगी हैं उनमें संतर्पण करना है बहुदोष वाले रोगी में शोधन करना है। अब हम बात कर रहे हैं आज डेमोन्स्ट्रेशन वगैरह की मेन टॉपिक है उद्वर्तन। उद्वर्तन में जो मेन पर्पज है उद्वर्तन का वो है जो अग्नि का नाश हो गया है क्षय हो गया है चाहे वो जठराग्नि हो और जठराग्नि की वजह से जो त्वचा में स्थित पित्त है अग्नि है उसका क्षय हो गया हो यानी भ्राजक पित्त का हमें उस अग्नि को फिर से वर्धन करना है जिससे कि अग्नि का दीपन पाचन होने से जितने भी इसकी संप्राप्ति के घटक हैं उन पर हम काम कर सकें। तो जो उद्वर्तना है वो दो टाइप का है बेसिकली, स्निग्ध उद्वर्तना या फिर उत्सादना। सेकंड है रूक्षण उद्वर्तना यानी कि उद्घर्षण रूक्षणा। ये जो है वैरायटी ये आपस में सेम है, सुश्रुत और चरक की बताई हुई है। स्निग्ध उद्वर्तन किन में करना है? जो पेशेंट लीन है, थिन है, वीक है, जिनके शरीर में इंस्टेबिलिटी है, वात प्रकृति के रोगी हैं और वात दुष्टि है, उनमें स्निग्ध उद्वर्तन करेंगे। स्निग्ध का मतलब है कि ऑयल वगैरह को हम साथ में लेके पाउडर के साथ में मसाज करनी है। अब हम मोड ऑफ एक्शन की बात करते हैं तो जो तेल है, तेल मेनली यूज होता है, तो इसमें जो तेल है वो है तीक्ष्ण, लेखन, उष्ण और वैवाहिक गुण के साथ है, जिसकी वजह से वो हमारे बॉडी के माइन्यूट चैनल्स में पेनिट्रेट करके वहां पर वात दोष को सफाई सबड्यू कर देगा। और देन फिर भी वात का शमन होने के बावजूद भी कफ का वर्धन नहीं होता है अगर हम तेल का प्रयोग करते हैं, जबकि वो संतर्पण भी करता है और स्रोतोशोधन भी करता है। अब हम रोक्षण की बात करें तो इसमें हमें मेन टारगेट होता है कफ। उसमें हम केवल और केवल ऐसी औषधि जो कि कफ का नाश करे उससे उद्वर्तन करते हैं पाउडर फॉर्म में यूज करके। और जो रूक्षण के द्रव्य हैं उनके जो मेन हम कैसे चूज करेंगे, वो रस और उसके गुण देख के। तो ये रस और ये गुण उसमें होने चाहिए, तभी हम रूक्षण के लिए, उद्वर्तन के लिए पाउडर या कोई भी मेडिसिन औषधि चूज करेंगे। मोड ऑफ एक्शन ऑफ रूक्षण उद्वर्तना, जब हम रूक्षण उद्वर्तन का प्रयोग करते हैं पाउडर से तो दोषों का पाक होता है और रस का साथ में भी पाक होता है। रस से मतलब है आम दोष युक्त रस। और साथ ही जो सिराएं हैं, चैनल्स हैं बॉडी के, उनके जो मुख पे जो आवरण है जो किसी तरह से बंद हो गया है आवरण की वजह से, वो उसको खोलना, उसको खोल देते हैं। त्वकस्थ अग्नि गेट्स स्टिमुलेटेड, जो त्वक के अंदर अग्नि है वो स्टिमुलेटेड हो जाती है। और मेद धातु और क्लेद का शोषण होता है, मेद का प्रविलायन होता है उद्घर्षण से। तो उद्वर्तन का जो प्रोसीजर है इसमें डिटेल में नहीं जाऊंगा। तो ये बेसिक हमें इक्विपमेंट्स वगैरह चाहिए, प्रिपरेशन करना है पाउडर से, बारीक हमें महीन सॉफ्ट पाउडर चाहिए। और उसके बाद पेशेंट को बॉडी पे हम उल्टी डायरेक्शन में नीचे से ऊपर की तरफ हम इसमें पाउडर से मसाज करेंगे, जबकि अभ्यंगम में ऊपर से नीचे की तरफ है, इसमें नीचे से ऊपर की तरफ है। और जो स्ट्रोक्स का सीक्वेंस है वो स्ट्रोक्स का सीक्वेंस ये रहेगा, सुपाइन पोजीशन में सीधे लेट के, जैसे अभी ये लेटे हुए हैं वैसे, फिर उसके बाद पलट के पीछे की तरफ प्रोन पोजीशन में ये बाकी स्ट्रोक्स रहेंगे। ये पश्चात कर्म है और प्रिकॉशंस वगैरह हैं। कॉम्प्लिकेशंस भी हैं, उद्वर्तन छोटा सा ही प्रोसीजर लेकिन इसके कॉम्प्लिकेशंस हैं हाइपर सेंसिटिविटी वगैरह की वजह से, या फिर पेशेंट को मेडिसिन नाक में, आंख में, मुंह में चली जाए तो उससे भी कॉम्प्लिकेशन हो सकते हैं। और उसके लिए ट्रीटमेंट के लिए भी यहाँ पे हमने शतधोत घृत कुमारी हरिद्रा लेप वगैरह का मैंने मेंशन किया है। जनरली जो ड्यूरेशन है वो किसी एक स्ट्रोक का बॉडी के एक स्पेसिफिक पार्ट पे 3 से 5 मिनट का टाइम दिया जाता है। ओवरऑल 25, 30, 40 मिनट में ये सेशन कंप्लीट हो जाता है पेशेंट का। तो इसको 7 से 14 दिन तक के लिए हम दे सकते हैं। कॉन्ट्रा इंडिकेशंस भी जरूरी है समझने। ड्राई स्किन कंडीशंस, प्रेगनेंसी, काफी कमजोर व्यक्ति हो, बच्चा हो ज्यादा छोटा, पंचकर्मा के तुरंत बाद, क्योंकि ऑलरेडी बात की वृद्धि हो चुकी होती है शोधन के बाद, और जिन पेशेंट को CHF की कंडीशन हो, DVT की कंडीशन हो, और खुले जख्म हो या रिसेंटली कोई इंजरी हुई हो, क्योंकि हम प्रेस करेंगे तो उसको पेन वगैरह का स्वेलिंग बढ़ेगी, या फिर अदर रिलेटेड कॉन्ट्राइंडिकेशंस है नीचे। जो कॉमनली यूज्ड ड्रग्स हैं वो ये हैं, जिसमें तेल है और चूर्ण है। अगर स्निग्ध देना है तो पाउडर के साथ चूर्ण मिक्स करेंगे, नहीं है तो प्लेन चूर्ण से ही हम उद्घर्षण करके उद्वर्तन हो जाएगा। ये भी ड्रग ऑफ चॉइस है बीमारी के अकॉर्डिंग, किस किस बीमारी में हम कौन कौन से चूर्ण वगैरह यूज कर सकते हैं। प्रोबेबल मोड ऑफ एक्शन ऑफ उद्वर्तना, इसमें प्रतिलोम गति में जब हम उद्घर्षण करेंगे तो जो मेडिसिन है वो रोमकूपों के थ्रू जाके उसका जो वीर्य है रोमकूप के थ्रू जाके भ्राजक पित्त को एक्टिवेट करेगा। वो वहां पे रस धातु जो त्वकगत है उसको, वहां पे जो उसकी आम कंडीशन है उसको सुधार देगा, और जो आवरण है स्रोतों में वो खुल जाएंगे, और अबद्ध मेदस और जो क्लेद है उसका शोषण प्रविलायन हो जाएगा। त्वक उपधातु जो मांस की उपधातु है उसकी मांस धातु की धातुवाग्नि की वृद्धि होगी, शोषण, और अबद्ध मेदस का, क्लेद का शोषण और डिसोल्यूशन हो जाएगा। सर्व शरीरगत जो वात और पित्त हैं वो सामान्य काम करने लगेंगे, और मधुमेह की संप्राप्ति के ये जो बेसिक घटक है वो भंग होंगे तो इसमें हमें मधुमेह या डायबिटीज में the reduction of leather followed by removal of our specified संप्राप्ति की घटना और प्रमेय hence Udvartana helps in managing प्रमेय. Thank you. Let's also demonstration.
Thank you so much, sir. Now we are moving towards the demonstration of Udvartana procedure. And the members will finally come forward. All those who are sitting behind kindly come and move forward. Interesting subject of Ayurveda, and I'm very sure by the time you come in the fourth year, you will be much more interested in Panchakarma. So that is why we wanted to show you a demonstration, some real demonstration of the procedure. One thing that you need to remember about Panchakarma is you need to have two white areas. One for a common activity and one for the Panchakarma. Because the Panchakarma even you cannot wear anywhere else.
केरला, महाराष्ट्र और जो हमारा है तो अलग अलग जगह में जो एक उत्पादन की फैक्ट्री है अलग पार्ट से कुछ जगह पे पैरों की तरफ से कुछ जगह सीधा मार्ग से शुरू करेंगे यहाँ पे बिल्कुल अवेलेबल की तरह से उसकी ट्राई कराया जाता है तो यहाँ पे हम शुरू करेंगे अपने पैरों की तरफ इसमें सबसे पहला इम्पोर्टेंट रूल है बालों की जो दिशा है उसके अपोजिट साइड में दूसरा जो लेंथ है हाथ पैर या फिर धड़ वाला पोर्शन और एक्सिस पेट से लेके इतने स्ट्रोक्स जो होंगे वो लंबे होंगे और जहाँ जॉइंट्स है नी है एंकल है हिप है वो फॉल मूवमेंट होगी क्लॉकवाइज या फिर एंटी क्लॉकवाइज प्रेशर अवेलम से ज्यादा और बिल्कुल सिग्नलाइज वे में और फिक्स ऐसे नहीं कि ज्यादा कम बराबर चलना
Student, if you wish to see the procedure, if you cannot see, you can come to this seat.
देखना है
This seat is empty. You can acquire this one. That one.
दोनों हाथ का जो यूज है ऐसी एरियाज में जहाँ पे हाथ चल सकते हैं जैसे कि अब हम एंकल जॉइंट पे आएंगे ऊपर से नीचे आते हुए प्रेशर नहीं लगाना है, नीचे से ऊपर की तरफ जाते हुए प्रेशर लगना चाहिए। नेक्स्ट है पैरों के साथ, पहले पेट के ऊपर, फिर चेस्ट के ऊपर, फिर हाथों के ऊपर। क्लॉकवाइज एंड क्लॉकवाइज। ठीक है, पेशेंट देख के कितनी देर करना है किस एरिया में वेरिएशन है, 3 से 4 स्ट्रोक आप दे सकते हैं। अगर पेशेंट के शरीर में बाल है तो उसको वहां पे ज्यादा रब नहीं करना है। हम चल रहे हैं चेस्ट की तरफ। आर्म्स दोनों ही एक साथ चलने चाहिए। जैसे ही हम ऊपर की तरफ मूव करेंगे जैसे पाउडर उड़ के पेशेंट की आंख में जा सकता है, मुंह में, नाक में, तो इसमें सरसों या ऐसी चीजें भी मुंह पे मास्क और आंखों को भी। एब्डोमेन, चेस्ट। अब है हैंड्स। हैंड्स में हम क्योंकि मूवमेंट हमें नीचे से ऊपर की देनी है, जबकि अभ्यंगम में जब हम चलते हैं ऐसे आगे खत्म होती है, चलना है तो ये मूवमेंट ऐसे ना आगे नीचे से ऊपर की तरफ ही जाएगी। ऊपर की तरफ। गर्दन की तरफ मूवमेंट। से एक्जिला की तरफ और एक्जिला के पास जाके आपका जो हाथ है शोल्डर ब्लेड की तरफ जाके शोल्डर ये मूवमेंट ऐसी फिर हम दूसरी तरफ भी कर सकते हैं नेचुरली। ऊपर की ओर करते हुए और ये हमारा हाथ या तो शोल्डर बैक के बाद हाथ जैसे नीचे पैर के तलवों की मसाज की आगे के एक हाथ से नीचे दबा के और दूसरे हाथ से इसके बाद और शोल्डर से जाके डाउन इस तरह से ऊपर से सारी स्टेप कंप्लीट हो जाती है अपने टाइम ठीक है पेशेंट के
एक बार पहले मुद्दा के लिए और इसके बाद जब पेशेंट का ये खत्म हो जाता है तो पेशेंट को अभी रेस्ट करने के लिए बोलेंगे, उसके बाद पेशेंट नहाने जा सकता है। विविध कई बार अगर मेडिसिन जो हमने यूज किया पाउडर अगर उसमें इरिटेशन है किसी भी रेस्पिरेटरी तो उसमें हम पेशेंट को ऑयल वगैरह अप्लाई करके कोकोनट ऑयल या दूसरा ऑयल अप्लाई करके थोड़ी देर वेट करके फिर नहाने के लिए उसके बाद हम पेशेंट से
Thank you so much, sir. I'm very sure you all are very motivated, and I can see a lot number of doctors in future. Now, concluding the program, I would like to thank Dr. and also for helping the demonstration. Now, concluding the program, I would like to thank our chairman, sir, Dr. Dikegar. He has always been very enthusiastic which we wish to conduct. And obviously, our fourth-year scholars have been working since morning with us, with both of us. I'm very thankful for all of them. And definitely, all the faculty members and staff members, and all the Panchakarma department, therapists, and the patients who all come to the OPD for the treatment. So, concluding the session, thank you all for joining us. Have a nice evening.